In a crisis, families can be left guessing about what a loved one wants, and that's where serious illness conversations and advanced care planning can help. This is Dr. John Shallat. He's the clinical director of hospice administration for OSF Healthcare, and he's joining us now this morning. Good morning, doctor.
Good morning. Thanks for having me.
Good to have you. Now, tell us a little bit about what serious illness conversations are and why they matter.
Serious illness conversations are really a planned and compassionate discussion between a patient who has a life-limiting illness, such as heart failure, and their medical provider. And the aim of the discussion is really to explore the hopes, goals of the patient and discuss the decisions they would want to make. And it's really important because as the diseases progress, oftentimes the patient isn't able to make decisions for themselves. And that makes this discussion important for multiple reasons, but one, you want to make sure that you can appoint the person or persons that you want to make those decisions for you. And two, you want to discuss what those decisions would be so that the decision maker and the provider know. And lastly, it's really important for that decision maker because making a decision about someone else's health or life can be very stressful and can cause a lot of guilt. And discussing these things and what kind of decisions you would like to make really help alleviate that stress and guilt on that decision maker.
So sort of like something leaves you incapacitated, unable to communicate in the hospital.
Correct.
Designating power of attorney, stuff like that.
Correct. Absolutely.
Now, what can these conversations look like, and what are some ways to avoid some common pitfalls that could leave people frustrated or upset?
Sure. I think the conversation should really look like a discussion between the patient and their medical provider, and hopefully that person that you would want to appoint that decision maker, hopefully they'd be there, and really anybody else that the patient would want to help them be supported during that time. And I think making sure that there's enough time is the most important thing. So you want to have enough time to not only discuss the diagnosis and the prognosis, but what kind of difficult decisions that might come up, and then enough time to have explanations and enough time that everybody feels comfortable and heard.
And real quick for us, who should look into and complete advanced care planning?
Well, all of us probably should, because you never know when you might become sick, but it's really important for those who have life-limiting illness, such as heart failure or cancer or chronic obstructive pulmonary disease or COPD, and really especially for the elderly.
Thank you so much for joining us today, Dr. Shallat. And we will have this interview along with many others on our website with more information. Another half hour of 25 News Good Morning is only minutes away.